Today we are going to read about the various autoantibodies. So in the left side you can see that the various autoantibodies, and in the right side you can see their associated disorders. Now let us discuss one by one in detail or step by step. So the antiposynaptic acetylcholine receptor is associated with the myasthenia gravis. The antipresynaptic voltage-gated calcium channel autoantibody is related to the Lambert-Eaton myasthenic syndrome. The anti-beta-2 glycoprotein 1 is associated with the antiphospholipid syndrome. The anti-nuclear antibody is associated with the non-specific screening antibody and often associated with the systemic lupus erythematosus. The anticardiolipin lupus anticoagulant is associated with the systemic lupus erythematosus and antiphospholipid syndrome. The anti-dsDNA or anti-Smith antibody is related to the SLE, systemic lupus erythematosus. The anti-histone autoantibody is related to the drug-induced lupus. The anti-U1 RNP ribonucleoprotein autoantibody is related to the mixed connective tissue disease. The rheumatoid factor IgM antibody against the IgG of the Fc region or anti-CCP and autoantibody is associated with the rheumatoid arthritis. The anti-RO or SSA or the anti-LASSB autoantibody is associated with the Sjogren syndrome. The anti-SCL70 anti-DNA topoisomerase 1 is related to the scleroderma, diffuse scleroderma. The anti-centromere autoantibody is associated with the limited scleroderma. It is also known as CREST syndrome. The anti-synthetase or the anti-SRP or anti-helicase autoantibody is associated with the polymyositis or dermatomyositis. The anti-mitochondrial autoantibody is associated with the primary biliary cholangitis. The anti-smooth muscle autoantibody is associated with the autoimmune hepatitis type 1. The MPO-ANCA or PANCA autoantibody is associated with the microscopic polyangiitis, eosinophilic granulomatosis with polyangiitis or ulcerative colitis. The PR3-ANCA or CANCA autoantibody is related with the granulomatosis with polyangiitis. The antiphospholipase A2 receptor autoantibody is associated with the primary membranous nephropathy. The anti-hemidesmosome autoantibody is associated with the bullous pemphigoid. The anti-desmoglein autoantibody is associated with the pemphigus vulgaris. The antithyroglobulin antithyroid peroxidase autoantibody is associated with the Hashimoto thyroiditis. The anti-TSS receptor autoantibody is associated with the Graves' disease. The IgA anti-endomysial, IgA anti-tissue transglutaminase, IgA and IgG demidecrate gliadin peptide autoantibody is associated with the celiac disease. The anti-glutamic acid decarboxylate isolate cell cytoplasmic antibodies is associated with the type 1 diabetes mellitus. The antiparietal cell anti-intrinsic factor autoantibody is associated with the pernicious anemia. The antiglomerular basement membrane is associated with the Goodpasture syndrome. So I have described the autoantibodies and their associated disorder. So you have to memorize all the autoantibodies and their associated disorder. I hope you enjoyed this lecture. So there is nothing to understand. You have to just mock up the autoantibodies and its associated disorder. Thank you.